our balance. It's something we all take for granted until we don't have it. Suddenly, life can change dramatically. About 1 out of 6 people will experience a balance problem in their lifetime, whether caused by disease, an accident, a part of aging, or for no apparent reason.
When you have a balance problem, all your normal daily activities become difficult. So just getting up and walking across the room, getting in and out of bed, getting in and out of the bathroom, managing your daily affairs, going to work, driving your car, walking your dog, all of those things, up and down your stairs, all of those things become a challenge when you have a balance problem.
4 years ago, Shirley, an active woman and talented artist, fell, hit her head, and began experiencing severe unexplained dizziness, nausea, and motion intolerance. She couldn't enjoy many of her previous activities, and at times could barely function. Like many balance patients, she literally spent years searching for a diagnosis and treatment.
And it's hard for me to say this, but it literally took 4 years of a life that was on the wane anyway. That's how I feel about it.
After many years, Shirley finally got the help she needed, thanks to a physical therapist trained in balance assessment and the use of state-of-the-art balance equipment developed by NeuroCom.
The NeuroCom technology allows me to objectify a balance problem, objectify the severity of it, figure out exactly where the problem is, and then treat it very specifically.
I want people to know that this kind of equipment is available, that this kind of whole process is available. And it's not just relying on what is generally done, giving you a drug.
If we could address the balance problem on the front end, we would save a lot of time, a lot of healthcare dollars, and a lot of frustration.
Since her assessment and training, Shirley has seen tremendous improvement in her health and in her ability to participate in everyday activities. People with a balance problem don't need to struggle for years. There is help available, and it could be as close as your community hospital.
To me, it was life-saving. It was literally life-saving.
We are going to be testing a 55-year-old woman on the NeuroCom Smart Equitest. We're going to be performing 3 tests of balance and stability called computerized dynamic posturography that includes the sensory organization test, the motor control test, and the adaptation test. So we put a harness on Mary here, and she's going to be strapped into the system to prevent falls. Okay, so come on up here, climb on up. Once we have her strapped in, we like to see that the carabiner, this metal ring, is sitting about at the level of her shoulder. So the strap is taut, but it's not so tight that it's going to catch her when she is just swaying back and forth. Okay? All right, now we need to position her feet. So Mary, what I'm going to have you do is I'm going to have you put this ankle bone here on that wide black line there. Good. And this one too. All the way up on the black line. Good. Stay right there for me just a second. We're going to choose the tests that she's going to perform today on this menu. From the main menu, I'm choosing dynamic conditions, choosing assessment, which is going to bring me into my test menu. All right. And of the assessments available in my dynamic system, I'm going to choose sensory organization test, the motor control test, and the adaptation test in that order. All right. Click on continue. Now the system is going to tell me exactly where I need to have my patient's feet positioned on the force plate. She needs to have her medial malleolus in the center, aligned with the center line, and the lateral part of the heel, the calcaneus bone, to the M line for her height, medium height. So I've got her so that her lateral part of her calcaneus is about at the M line, and the medial part of her heel is at that wide black line. All right? Let's move forward just a little bit for me here. Good. So So Mary, we're going to be performing a test that has 6 conditions. I'm going to let you turn this on for just a second and show her what the test is all about. You're going to have 6 conditions in this system. You get 3 little tests of each condition. Sometimes I'll have your eyes open. Sometimes I'll have you close your eyes. On some of the conditions, the walls are going to move, and on some of the conditions, the floor is going to move. So I'm going to tell you what's going to happen every step of the way, but you don't get any feedback from this. I'm going to have you turn this off, okay? Each test is 20 seconds long. During that 20-second test, you get to stand as steady as possible. No fidgeting, no nothing, okay? In between the tests, you can move a little bit. So here we go. The first test is very easy. You're going to stand quietly with your eyes open. Now, I've got her set back. I'm going to check her feet because the center of gravity alignment is slightly off. So I'm going to come back and check her feet. Scoot forward just a little bit. And same thing here. Yeah, you can splay. Great. And move this heel out a little. Great. All right, and she can splay her feet a little bit for comfort. All right, stand in the straight, arms relaxed. You don't have to worry about vision right now. You're going to keep your eyes open and testing. So stand really steady for 20 seconds. So on this condition, she's standing quietly with her eyes open. So she's got all 3 sensory systems available for balance. She's got vision available, somatosensory information from her feet, and stable information from her inner ear. Okay, that's 1. You're not, okay, and then we're going to do 2 more just like that. You ready? And testing. So we anticipate that somebody standing in this type of sensory condition where all their systems are available for balance, their nervous system would automatically default to using somatosensory information in the feet and the ankle. Okay, that's 3. And I get feedback right away, but the client cannot see that. 1 more time, just like that. Testing now. Good start. All right, now you get to do the same thing with your eyes closed. So I'm going to tell you when to close your eyes and when it's okay to open them. You keep your eyes closed the whole time. Ready? Close your eyes and testing. Okay, so now she's standing on a firm surface with her eyes closed. So we've eliminated vision. She still has the feeling in her feet and ankles to use for postural control and balance, and she still has the inner ear function for balance. Open. Okay, get ready. We're going to do it 2 more times. Close your eyes and testing. All right, now normally in this condition, we expect that people will default, their nervous system will automatically use the feeling in the foot and ankle for balance, and then vestibular comes in second. So it's expected there's a slight bit more sway, but not very much, because somatosensory is still the primary system. Open. All right, doing good. 1 more time. Close your eyes and testing. Very good. Open. All right, now you get to keep your eyes open, and this time the walls might be moving. All right, so your job is to stay steady even if the walls are moving. Get ready. Eyes are open. Stand steady. Starting now. There is a strap on the back of the harness here. There's a handle in case the person starts to lose their balance. I can assist in some way or catch them in case they're falling. Nice. You okay? All right. You get 2 more just like that. Get ready and testing. other thing we look at here under these conditions where the floor is not moving is step 2. Get ready, you got one more. Testing now. Because we want to see that because she's not challenged a lot with her balance, that she's swaying, making little adjustments with balance over her ankle. She's not using a lot of excessive movement to maintain her balance. That would be normal in this condition. Good. You all right? Looking good. All right, you get to keep your eyes open now, but this time the floor might move underneath you. All right, so your job is to stay steady even when the floor is moving. Get ready and testing. All right, so we're looking for her ability to stand steady even without accurate information from her feet and ankles. That's 1. You okay? All right, same thing again, starting now. So if we disadvantage the floor by making it a little bit unsteady, she has her eyes open and her inner ear is still functional. If there's no pathology, she should be able to use vision very strongly for balance, and then secondary system would be vestibular. Very good, you're looking good. You got one more just like that. Testing now. All right, and then we don't typically tell the clients how the floor is moving or how the walls are moving, but when she sways, that's what causes the floor to sway. So it's actually going to move with her when she's swaying, so she doesn't get any feedback from the visual system or the ankle, somatosensory in the ankle. All right, you have 2 more tests in this machine here on this particular one. The next one, you're going to have your eyes closed, and the floor is going to move underneath you. All right? Excuse me. So you keep your eyes closed the whole time. If you have to open them for any reason, you let me know because I need to stop the test. Ready? Close your eyes and testing. Now what we've done is we've disadvantaged the somatosensory system by moving the floor, eliminated vision by closing the eyes, and the only reliable balance sensory system for balance and postural control right now is her vestibular system. So she has to rely on that to know what upright is. Open. So we do expect a little bit more sway on this one. That's normal. All right, same thing again. Close your eyes and testing. Nice. Open. All right, get ready. Close your eyes and testing. One more just like that. Okay, she's actually doing very, very well on this test. The gray area you might see over here on the computer means the abnormal range. She's way up above that abnormal range. The green lines represent good performance. And open. Looking good. All right, the last test on this one, last condition, you keep your eyes open, but this time the walls and the floor both might move. So your job is to stay steady when things are moving around you. Get ready. And testing now. So you can see that as she sways, the walls and the floor will sway with her, which makes visual information and somatosensory information from the floor unreliable for balance. So again, the inner ear or the vestibular apparatus is the only accurate sensory cue she's getting. Nice. Okay, get your bearings. Take a breath. And get ready. We got 2 more just like that. Testing now. Good. All right, you got one more just like that. she's doing very, very well when the walls are moving. There's a lot of people that get tested in this system that don't do well. They trust vision so much that they sway with the walls. They don't realize that the walls are moving around them. So they're going to lose the balance or fall during those conditions. So this one really focuses on the vestibular system as well. All right, so you can relax and breathe for just a second, and I'll focus on this for just a minute. We'll take a brief look at the results. We have a composite score, which is an average score of all 6 trials, all 3 conditions of each trial. She's well within the normative range. Her stability bar is green, and it's all very close to the 100% stability up here as far as her equilibrium score. So this is a very, very good test. This score that we got is based on normative data for people of her same height. We're going to move on to the motor control test. All right, Mary, for this test, you're going to stand steady on the platform, but this time the platform is going to move like this. It's going to go backwards or forwards very quickly, kind of like someone's pulling a rug out from under you. First, it's going to go a little, small one, then medium, and then big ones, and you get 3 of each. Okay, your job, again, stand steady and try to stay as quiet as possible. Don't let it knock you over at all. Okay? So the first ones are going to go backwards, but very, very small, starting now. Okay, you get 2 more just like that. Good. All right, now we're going to do medium ones backwards, starting now. So the force plate's sliding, and that's causing a reaction. She has to react to that to keep her balance. And since we know how fast information moves in the nervous system, we can actually measure the latency of her response. So how much time it takes her body to respond to this surface perturbation. All right, now the big ones. You ready? Starting now. Okay? So the small ones are barely at threshold. The larger ones are saturating for the nervous system, so we should get a nice, strong response, and she's doing quite well on this test. Good. All right, now we're going to do the exact same thing, but the floor is going to move forward. 3 times small, medium, and large. Small ones starting now. People that might not do well on this test would be people with unilateral peripheral problems that are orthopedic, people with back pain, some people with neurologic pathology. Medium ones starting now. Central nervous system dysfunction where the person doesn't have adequate ability to get information, sensory motor information in and out of the nervous system. Good. All right, big ones forward. Testing now. Good. And the reaction she's getting is very normal. You want to see a nice strong reaction from the client that you're testing. Good job. All right, relax for a second. We're done with that one. Okay, Mary, the last test we're doing on here is called the adaptation test. On this test, the force plate's going to rotate. It's going to do this. Toes are going to go up really, really fast. It's going to go 5 times in a row, and each one is exactly the same. All right, so your job is to stand steady as possible through all of those perturbations. Once it gets started, it just keeps going. Okay, I don't stop the test. You try to do all 5. Get ready. Toes are coming up quickly, starting now. Okay, so in this test, the platform is going to rotate 8 degrees up at a known speed, so we can cause a toes up perturbation for the client. And what we're looking for here is if we repeat the same stimulus 5 times in a row, how does she do? How does her nervous system adapt to that stimulus? Is she able to do it? Is she able to get better and better at it and have a smaller and smaller reaction. And that's what we would expect from people who get used to the same stimulus over and over. Nice job. All right, now we're going to do the same thing, but this time your toes are going to go down. All right? So your job again, stand steady. Don't let it knock you forward. Here we go. Testing now. Good. Okay, again, we're getting lots of great scores for her. Her stability scores on this test are really good. She's not swaying a lot. She's not falling. It's not knocking her over.